Hi, I'm Craig, and I help veterans go from feeling stuck and unseen after service to living with confidence, connection, and purpose so that they can thrive in civilian life and relationships. Hey guys, welcome back to the channel, and thank you so much for watching. We are continuing our series of 30 VA claims in 30 days, and today we're going to talk about skin conditions. Skin conditions are scars and burns, conditions of the musculoskeletal and dermatologic system. You might find that interesting that skin, scars, and burns are also deal with the musculoskeletal system as well. So let's dig into it a little bit. In the context of VA claims, you have to understand that skin covers scars and burns, including burn scars, unstable, painful scars, disfigurement under the skin, and the dermatologic evaluation schedule. So it's dermatology and musculoskeletal. The reason why this matters for veterans is because service-related conditions, particularly combat, burns, training injuries, chemical exposure, surgical scars from service injuries, they often lead to permanent skin conditions. It's skin scarring, disfigurement, tissue loss, and underlying soft tissue damage. This is an oft recurring thing. I know, having served in the Navy, oftentimes if you dealt with firefighting or you dealt with things that have a lot to do with fires or burning, particularly also burn pits. If you dealt with any toxic fumes, gases, oils, you would fall under this, any abrasion of the skin, scarring, or burning. Common veteran presentations: burn scars on the face and neck, multiple scars from traumatic injury or surgery, unstable or painful scars on trunk extremities, and soft tissue damage underlying the scar, disfigurement, and that is visible in daily life. Regulatory reference for these skin conditions are obviously the 38 CFR 4.118, and this is the schedule of ratings for skin. One thing you'll notice about 38 CFR is for every category, there is a particular rating schedule for that category. So you'll always be referred back to the 38 CFR and where they have that schedule rating in the US code. So really important to understand where these are so that you understand how you rated there. And then of course there's VA manual guidance, the M21-1 Adjudication Procedures Manual, Part 5, Subpart 3, Chapter 10, Skin Conditions. That's where you'll find it. I'll just see if I can provide a link either on the screen or in the description of this video. And how the VA considers this particular condition on the scale. Much like everything else, it's 0 to sometimes up to including 100%. And so the relevant diagnostic codes are DC 7800. That's a burn scar of the head, face, or neck, or scar or other disfigurement of the head, face, or neck. DC 7801, which is a burn scars not of the head or face or neck with underlying soft tissue damage. I remember having a particular scar on my body, and I did not meet the criteria for that scar because it didn't meet this size criteria under Diagnostic Code 7801 or 7802. So it has to be a certain centimeter diameter and length in order for you to meet the compensable level for that scar. And whenever we think about pain, remember we're thinking about pain levels, generally speaking, from 1 to 10. So if you're at a CMP exam and they ask you how painful it is, right, you tell them from a level of 1 to 10 how painful that is on your worst day. That's a lot of things. That's another thing a lot of veterans don't understand, is that you have to make sure that you categorize what you're claiming a condition for under that specific code, because you could either A, have the wrong code, or B, you could be missing out on other diagnostic codes that require or that are acceptable for a VA rating. So you want to make sure that you are specific on what type of thing that you're experiencing, which body part it is. Pivot to evidence and strategy. Understanding how the VA rates skin conditions is key to building your claim narrative. I always talk about telling your story and ensuring you submit the right evidence. I always talk about telling your story on here. So really important that you have this information so that you can submit your own VA claim narrative. We're going into case law now. Okay. And remember, case law is to be submitted. And I tell you guys this all the time because I have veterans who make mistakes in this area. Case law is only to be submitted if it's a case that's similar to yours. If it is a case that is legitimate to the condition that you're applying for. Okay, so it has to be similar, legitimate to the condition that you're applying for, right? And it has to be documented in your record. All right, that condition has to be documented in your record. Don't just throw case law all over the place. Make sure you use case law appropriately, accurately, and try to make sure it's the most current case law. All right, the reason why it matters, even for skin conditions, VA must consider all residuals: pain, functional impairment, disfigurement, social, occupational impact, and apply broad interpretation, resolving doubt in favor of the claimant. Okay. Applicable policies are 38 CFR 4.2, interpretation of exam reports, and then 38 CFR 4.3, resolution of reasonable doubt. 4.2 means that examiner has to consider the entire history of that particular scar. He can't just consider something recent. He's got to consider the entire history of when you first contracted that pain, that skin, burn, or scar. And then 4.3, resolution of reasonable doubt. When doubt exists, favor the veteran. Reasonable doubt. When doubt exists, favor the veteran. Guys, this is something that most veterans don't even really get in their minds. When there is doubt on your claim and the evidence exists, do you realize what that means? What that means is it falls back to the story that you tell about how you are feeling or what you're experiencing or what you have endured. You have to become a master at owning and telling your own story. I want to speak to a veteran out there who's hesitant on filing a claim, hesitant on, talking about what happened to them because maybe you feel ashamed, maybe you're embarrassed, maybe you don't want to go and wade into those waters. So you use the excuse and you say, you know what, this is not for me. Money is not all that important. And guess what? It may not be all about money for you. And I would agree with you. The money isn't all that important. But you know what's more important than the money? What's way more important than the money is telling your story and making sure you get the care that you need for the thing that you went through, and breaking through the stigma of not asking for help, breaking through the stigma of not feeling like that you are worthy and you matter, and that the thing that you went through is worthy of being brought to the table or being brought to the light so that someone can help you fix it. That's what's more important than the money. And that's the reason why going through this process is valuable. And that's the reason why I would encourage every veteran to use the process that was given to us when we served, and that was promised to us when we served. Use that process. Veterans have different reasons why they go into the VA disability system. As many different reasons as there are veterans exist. But no matter what reason you go in for, make sure you use the benefits that are applicable to you and that are set aside for you. So that's a little bit of case law. Even if you had a scar from some type of procedure that you had and it caused you not to be able to wear your normal duty attire, your gear, your garments, right? Your outer garments, or perform your duties, you want to make sure that that's listed in your personal statement. Application in your narrative. Okay, so you could say something like, my burn scar on my face results in visible asymmetry, one feature, and permanent tissue loss, matching the criteria under Diagnostic Codes 7800 for 10%, 30%, 50%, 80%, depending on the number of features. Or you could say, my multiple unstable scars on the trunk repeatedly open up under the uniform load and body armor, matching Diagnostic Code 7804 for 1 to 2 unstable scars, 10%, or 3 to 4 unstable scars, 20%. You are simply citing the 38 CFR, which is exactly what the VA wrote and said that you should cite. You want to do that. You can do that. You have the right to do that. if you are experiencing that condition. Under 4.3, any doubt about extent of scar instability should be resolved in my favor because military treatment records show repeated skin breakdown. All of these examples will be on the screen, or I'll make them available in a PDF for you because you need this literature. You need these examples, and you need to include this in your claim and your statement. And on these videos, we won't spend a whole heck of a lot of time on post-service claim strategy because I believe I give you so much in the first parts of the video that we can just do an overview of post-service claim strategy. But there might be some nuances depending on what you're filing for. And I've already been talking about functional loss and instability. So you want to make sure you have medical notes that outline functional loss, particularly when you're talking about 7804. You want to have treatment records for burns, any grafts of your skin, anywhere where the skin was broken down or that was painful, dressings, predisposition to infection, showing chronic impact. You want to make sure you have all of those things. And as we always say, service connection and nexus evidence is hugely important. So you want to make sure you have that service treatment records documenting everything that happened to you, burn, trauma, painful things, medical opinion, linking the current scar condition, any kind of disfigurement that you might have, linking that to your current symptomology and your in-service event, okay? Any aggravation of those things, any peeling back of those things, those scars, is compensable. And then, of course, have buddy lay statements that are written. I've got a 7-part series on how to write buddy lay statements: functional, narrative, persuasive, before and after, contrast, all of those things. Ways that you can write your statement to make sure that you describe your symptoms in a very descriptive way. And then describe your functional impairment, like if you can't wear a mask or helmet because your scar tissue breaks down. Okay, like that could even be like, I can't wear my motorcycle helmet. I can't ride because I have to wear PPE. In order for me to wear PPE, I have to be able to put that helmet on my head. I can't do it because I have tissue breakdown because of the scar on my face or my neck. That's just one example. When body armor straps rub your scar, those kinds of things. Visible scar. The visible scar, I want you to hear this. The visible scar could lead to certain social anxiety, depression, panic, right? Those kinds of things. And if it leads to that, then you can also file a mental health claim as a secondary result of your painful scar. Some veterans feel embarrassed. They aren't able to establish meaningful and maintain relationships because of how they feel like they look or how they are seen. And unfortunately, you can't necessarily change society's viewpoint on that because first impressions are everything. And even if you are into a situation where you feel like that you can't really secure employment because of that, because you're being seen in a particular way because of the skin, scar, burn, or anything of that nature, you want to make sure that's documented, and you want to make sure that you know exactly what's going on and why that's a situation for you. And then secondary conditions always have to involve cumulative impact. For secondary conditions, consider if those scars or those burns lead to like avoidance, muscle atrophy, gait changes, mental health issues, all of those things. And then there's some citations that you need to put in your file: 38 CFR 4.118, and then use the M21-1 chapter for skin conditions. All right. Do it in order and stay consistent and be persistent. Okay. Build a timeline in service, immediate treatment, and scar formation. Then the next timeline will be post-service exacerbation or aggravation. And then be persistent. Talk about its current impact. So you got, if you were to build a timeline, it'd be in-service event, immediate treatment, scar formation, post-service exacerbation, or persistence, and then current impact and functional limitation. Ensure you show that the scar is not just cosmetic, but it causes pain, breakdown, functional impairment, visibility, or disfigurement. I know you can do it. I know that you can win your claim. I know that you can prove to the VA that your skin scars and burns are actually a result of service, particularly if it's documented in your medical records. I just want to give you some tools and tips to show you how to file that claim successfully. If you like this video, please like and subscribe. Share with another veteran who might need it. And as I always say, live royally and live well. Thank you for watching, and I look forward to seeing you in the next video. I hope you guys enjoyed this video. Thank you for watching. If you want any more information about the subject of this series, be sure to check out the playlist right here. And remember, live royally and live well. Thanks for watching, and I'll see you in the next one.